Good morning, everyone. Welcome to this webinar on BS ISO 45002. We'll get started at about 2 minutes past the hour. I can see the attendee numbers climbing, so thank you all for joining, and we'll get started in a couple of minutes. Morning, everyone. It's 2 minutes past the hour, so we'll make a start. Thank you very much, everyone, for joining this webinar, introducing BS ISO 45002 on implementing, maintaining and continuously improving your OHS management system. If I could have the next slide, please. Just a quick piece of housekeeping before we get into the actual webinar. This is a listen-only webinar and it is being recorded. We will try and answer a few questions at the end of the webinar if we have time. We've only got an hour today and we do have quite a bit we want to get through. But if you have questions, please do use the Q&A button in the panel and post your question. In the same place, using the Q&A function, if you have any technical difficulties throughout the webinar, please do post them in there and someone from our team will try and help you as soon as possible. And lastly, following this presentation, we will send around a survey. Please do fill it in, any feedback welcome, how it went, what we can improve, and after you complete the survey, you will get access to this slide presentation as well as access to the recording. So if I could have the next slide. We have two great speakers joining us today, and I'd like to invite them both to pop their cameras on now and we'll do some introductions. Before I hand over to our speakers to introduce themselves, I'll introduce myself. My name is Lottie Humphries. I work for BSI. I'm the committee manager to ISO TC 283. That's the ISO technical committee, so the International Technical Committee on Occupational Health and Safety. We look after the development of occupational health and safety standards, so the management system standard ISO 45001 and all of its related standards. And I'm also committee manager to HS1, which is our national UK mirror committee for the same subject. So I'll hand to Jeremy first. Jeremy, if you could briefly introduce yourself.
Thank you very much, Lockie. So my name is Jeremy Bevan and I'm, as my title there on the slide says, a policy manager with HSE. I've been with HSE since 1986. I have extensive experience both as an inspector, looking at how well set up businesses are to manage health and safety in a structured way, which is very much our topic today. And more recently, plenty of experience looking at how we as an organisation interact with particularly smaller businesses on health and safety, and looking at the way other players across the health and safety system that are non-government organisations, so including BSI and health and safety consultants, help smaller businesses to take a proportionate approach to managing health and safety. And I'll also be touching on the importance of that when I present shortly. Thank you, Lockie.
Thanks very much, Jeremy. And Ruth, would you like to introduce yourself?
Lovely, thank you, Lachlan. Morning and afternoon to all who are listening today on the webinar. I'm Ruth Wilkinson from the Institution of Occupational Safety and Health, so IOSH for short. We're the chartered membership organisation for occupational safety and health professionals. We've got approximately 50,000 members across 130 countries, or thereabouts, so don't hold me to those figures. I'm in the role of head of policy, so my remit is about advocacy and influence on OSH matters, social sustainability and on worker well-being. In my career, though, I have been in health and safety positions in different organisations, from manufacturing, local government, and also at IOSH, where I've developed occupational health and safety management systems, and I've also been a user of ISO 45001. So I'll be bringing all of this together in this session. So thank you, Lockie.
Thanks very much, Ruth. If we could go to the next slide, please. I will give a very kind of brief overview of what BS ISO 45002 is. I won't spend too much time on this because I'm sure everyone's looking forward to hearing presentations from our two speakers after hearing those introductions. So just to quickly touch on what today's webinar will look like. We've already done our housekeeping and introduction. I'll quickly give an overview. We'll then have a presentation from Jeremy, followed by a presentation from Ruth. And in the end half of the webinar, we will go to some discussion questions. Before, at the end, as I said, we'll take one or two audience questions if we have time. So introducing BS ISO 45002. This is our newest standard in the occupational health and safety remit. It published in the middle of February, and as you can see on the screen there, it's general guidelines for the implementation of ISO 45001. So the first thing I wanted to highlight as we set the scene for this webinar is who BS ISO 45002 is for. So this standard is for people who are already using ISO 45001. It's also for people who want to use 45001 for the first time. But thirdly, and I think quite importantly, it's also for organisations that aren't yet ready to comply with all of 45001. So maybe you're not ready to look at all the requirements, but you do want to systematically improve OHS. And in that case, 45002 is a resource for you. So if we could just go to the next slide. How does it do that, and how does 45002 help your organisation? It covers how to establish an OHS management system. It also covers practical insights on implementation as you're putting that system into place, highlighting particular challenges and opportunities. And for those of you that are maintaining or wanting to improve your existing system, it's full of examples, case studies, real life scenarios. It really goes over putting the ideas into practice. So with the scene set, I think we can consider it set. I will hand over to Jeremy first, who will take us through 45002 from a regulator perspective. Thank you, Jeremy.
Thank you very much, Lockie, and if we could have the next slide, please. So I want to do three things for you in the next 10 minutes or so. First of all, talk about why a systematic approach to health and safety management is important. And clearly, those of you who are already implementing ISO 45001 will be only too well aware of this, but there may be those listening in who aren't quite sure whether they're taking a systematic approach or what it involves, and I hope to shed a little bit more light for you in particular. I then, as I said in my introduction, I want to talk a little bit about the importance of a proportionate approach, particularly with small and micro enterprises in mind, and then give you a few indicators of how HSE will be interacting with ISO 45001 and BS ISO 45002 when we turn up at your organisation to carry out a health and safety inspection or to investigate an incident if you're unfortunate enough to have had one of those. So why take a systematic approach to health and safety management. HSE and I think BSI as well are only too well aware that organisations don't exist just to satisfy our expectations. They exist to make things, to provide a service, and to do it well, and to do it as far as possible consistently within a repeatable framework. And of course, standards like ISO 9001 on quality assurance and management and 14001 on environmental management have been around a long time to help organizations with that. And it's the same now with ISO 45001 for health and safety management. And all of these systems follow a standardized framework. So if you're already familiar with using, for example, ISO 9001, you'll find that the way you work through ISO 45001 is the same. The clause headings are the same. The overall approach is very much the same. Another reason why it's important to take a systematic approach is, of course, that health and safety law requires it. At the most general, high level, organisations are required to ensure that they protect the health, safety and welfare of their employees so far as reasonably practicable. That's in the Health and Safety at Work Act 1974, the framework legislation that's been in place for half a century now in the UK. Beneath that, you have sets of regulations like the Management of Health and Safety at Work regulations, which call for employers to carry out a suitable and sufficient assessment of risks that identifies the need for actions to remove or mitigate those risks. So you're already here into a structured approach to looking at the dangers that may exist in your workplace and setting up systems to make sure that you manage those appropriately. And then further on in the Management of Health and Safety at Work regulations, you have principles for management or the prevention of risk. So you avoid it or you combat it at source, or you adapt the work to the individual in what's known as a hierarchy of control. You always seek to remove the risk first if you can. And then also you have to have arrangements for planning how you manage health and safety, for organising it, who's going to do what, how you control it day to day, and how you monitor and review what's happening, investigating incidents, near misses, and so on. And there's also a requirement to have competent advice to help you do that, whether that's from within your organisation or external. All of those things require you to take a considered approach to health and safety. And ISO 45001, with the support of BS ISO 45002, can help you do that. These documents set out in a structured way how you can meet legal requirements and how you can systematize what you do to manage health and safety in a way that supports the fundamental aim of your business, which, as I said right at the start, is doing what you do as well and as effectively as you can, and always looking to do better where there's an identified need to do so. And HSE very much supports the ISO 45001 suite of documents as one means of helping businesses to manage health and safety better. If we could go to the next slide, please. It's become increasingly important to HSE, and I suspect to many others as well, that a proportionate approach to managing health and safety is vital to ensuring its success. Organisations are different in all sorts of ways. There are, of course, many different sizes, from micro right up to huge multinational organisations. They have different risk profiles. And because of those things, they also have different levels of culture and different levels of complexity. And all of those things will affect how you set yourself up to manage health and safety. So for example, in a micro business, it is typically the case that one senior person will wear many hats. They will be the HR function, they will be the health and safety function, and many other things besides. And communication with the workforce will probably be much more informal, because you see your workforce every day, whereas in a large dispersed organization, you may not. They may be on different sites, for example. Of course, all businesses want to stay in business and improve where they can and where there's an opportunity to do so. And there's absolutely nothing wrong with being aspirational and moving beyond where you currently see yourself. But we understand that for the very smallest businesses, looking at something like ISO 45001 or this standard that we're talking about today, it's the implementation guide, is rather daunting, or can be, if you've not come across this sort of thing before. So if you're thinking of dipping a toe in the water of a more systematic approach to managing health and safety, maybe a place to start is to ask yourself, how systematic are we right now in managing our health and safety? And if you want a straightforward check for a small, low-risk business, HSE's guidance on the right, the image on the right here, health and safety made simple, would be one place to start doing that, as would HSE's Health and Safety Toolbox. If you type either of those phrases into our website search engine, you will find them very quickly. Equally, if you think you've got to the stage where the ISO 45001 suite of guidance is where you want to go next, then why not have a look at BSI's little book of health and safety management, which talks about the systematic approach that I've already outlined, but in the context of this suite of standards, and so helps you think about whether a certified, third-party verified approach to how you're set up to managing health and safety might help you. And maybe you might decide that you want to take a step-by-step approach to that. So take the standard, for example, take clause 5 on leadership and worker participation, and say to yourself, well, we'll start here. We'll run the rule over what we do to make sure that our senior people are well set up to provide leadership genuinely on health and safety. And then if we're happy with that, then maybe we'll go to looking at how we plan. So clause 6 of the standard, and using 45002 to perhaps help us sharpen up where we need to in terms of how we plan to manage health and safety. Particular word here to those organizations that may be thinking of obliging those in their supply chain to implement 45001 using 45002 to help them. It can be very daunting for a very small organization working for a larger one that's already thoroughly familiar with the way the 45001 system works to get started. So ask yourselves, how can we help our suppliers translate the concepts that we're thoroughly familiar with into language that they, at their much smaller scale, can understand? How much time might we need to give them to familiarize themselves with what they need to do, given that they are starting from a very low base? Have we got worked examples of what we've done to implement the standard? For example, very small suppliers with a peripatetic workforce might be struggling to understand how best to supervise that workforce when management physically can't be with them on every job that they go to. If you have worked through that yourself as an employer, maybe you could invest some time with them to make sure that the fit of the standard with what they do is as good as it could be. But it's always worth asking whether you are seeking to implement the standard down the supply chain, or whether you're doing it for yourself, whether you can evidence what you do in a way that works for you. System standards like ISO 45001 do require documented information. Now, I think the way that technology has developed over the years means that we're not now necessarily looking at a piece of paper or even a file on a computer. And the example that we often give is that in a very small organization, let's say 6 employed, where they are required to have a statement of their health and safety policy, could that, for example, be a short video that the director of the company has recorded and sent to every member of the workforce so they have it on their mobile phones? It's much more likely to work for a very small workforce than what we typically see in organizations, which is a 16, 20, 25-page document given to every member of the workforce to sign to show that they've read it. And when you question workers, it's not always apparent that they've absorbed what that safety policy says. So think about what's the most effective way, what's the most proportionate way for you as a small organization to get the health and safety message across and evidence what you do systematically but proportionately. So if we could go to the next, my final slide, please. And I just want to say very briefly what HSE would be looking for if an inspector would turn up on your doorstep one day to say, you know, we want to come and have a look at how you manage traffic safety on your site, for example. And I think it's important to say that having certification to ISO 45001 doesn't give you a free pass, and I hope you wouldn't expect that to be the case. We will still want to be looking at the evidence you have to tell us whether what you say that you do to manage a particular risk manages what you actually do. And so, for example, if we come across a 75-page suite of management system documents for an organization employing 3 people, we might well be convinced that that is an A1 way of managing health and safety for that organization. But we would have questions, I think, particularly if an external health and safety consultant has been involved. How well does the person in charge of the other 2 understand what they need to do with the documents that the consultant has generated? Are they working, living documents? How are they used to manage health and safety? And of course, the more pages you have, the more risk there is that you give yourself systems to trip yourself up on, because your organizational arrangements are not mature enough, strong enough, if you like, to cope with that level of structured detail in managing what you do. And so, for example, we are, and let's take a slightly larger organization now, say 20 employed. We are with the operations director, and the operations director leads our inspector through a vehicle entrance into a warehouse, not a pedestrian entrance. If we've already looked at your documented information to say how your leadership gives the lead on health and safety, we're immediately going to be asking questions about how well embedded that is if the person in charge of how the site runs day to day isn't thinking about safe movement around the site and avoiding contact with vehicles. The plan, do, check, act approach that ISO 45001 and today's standard 45002 take are a systematic approach that HSE recognises and also endorses through its own guidance. So we are speaking very much the same language here, but a site inspection will always go through each of those elements to look at whether what's planned covered everything in respect of which they need you to be planning, whether you've done everything that you said that you would do, whether your systems for checking that it's all working properly are robust enough, and for example, how you've investigated incidents or near misses to show that is the case. And then, of course, going back round the loop, closing off any actions that show the need for that continual improvement that this standard requires. Finally, I want to just say a word about certification and competent independent verification that the systems you have in place are effective for your organisation, its particular culture and its risk profile. That independent verification, of course, is only a snapshot. And if the following week your systems change, then it's up to you to make sure that how you change the way you manage health and safety to cope with those changes keeps up with those new risks that may develop as a result of the changes. It's also important that who you select to certify your progress against 45001 is competent, not just in working their way through a management system standard and identifying a non-conformance, but knowing about health and safety, knowing about your sector, and I would say also knowing about organisations of your size and the way that they are different, for example, from much bigger organisations. So do take that responsibility of being an intelligent customer very seriously when you're seeking external verification of what you've done to manage health and safety against this system. Having ISO 45001 isn't required by law, but it can provide you with a structured framework for ensuring a healthy and safe workplace. Some of what ISO 45001 requires goes beyond the law, but it all fits together in helping to ensure that you take a very structured approach. And I commend it to you as something that can only be of use to you in managing your health and safety done in a proportionate way that's right for your organisation. Thank you very much.
Thank you very much, Jeremy. That was really, really insightful, and lots of things to pick up on in that I think we can pick up on towards the end of the webinar, but it, I think leads very well into Ruth's presentation. So Jeremy, you mentioned a couple of specific clauses there and giving examples to businesses as they get started with some of the requirements for 45001. So I'll hand over to Ruth now, who will take us through some examples.
Oh, that's lovely. Thank you, Lockie. And thanks to Jeremy. You're right. Jeremy talked a moment ago about the Plan, Do, Check, Act, and that's exactly where I'll start. And I do thank Jeremy for giving the overarching perspective on management systems and also the HSE's perspectives. What I'll do now is I'll dip into those practical insights from a user perspective going through the management system, the development, particularly in relation to ISO 45001, 45002. And I suppose just to be clear from the IOSH perspective, we do advocate for the good principles that are within it. And I suppose following on from Jeremy, whether organisations choose to go for certification or not is down to that organisation and for all the different variables Jeremy mentioned, but there are good principles within these standards. So having developed management standards, one using 45001 and others sort of following HSE framework previously. When I did first pick up 45,001, I was obviously faced with this clause here, so I thought this would be a nice starting point. Rather than go through everything in the limited time that we've got, I've picked out a few to make sure we cover the Plan, Do, Check, Act. But if you can see that the small little image that I've added onto the slide that is taken from 45,001 and 45,002, you'll see in that outer box around the planning, the doing, the checking, the acting, around the leadership and the worker participation, it's bound with that context. You know, what's the external environment, what's that internal environment that's being operated within. So just like you who have probably either gone through this or will be going through it, me personally was at the end of, well, how do I do this? You know, I understand what they are, but how do I fundamentally go through that process? How do I document it? How do I assure myself that what I've done is adequate and sufficient to meet these requirements? So I'll be coming to it from that approach, really. You know, when we look at the context, there are different external issues. So examples of external issues could be economic, financial situation, technological innovations, political, social unrest, legal requirements, other requirements. So what is that external environment that you are operating within? But then there will also be internal issues. So there could be consultation, participation. So what issues are workers or others raising? What policies, practices, what's your vision, your mission, the values, the objectives of the organisation that you need to do. So this list goes on, there'll be quite a few of these. What I did internally was use a PESTLE analysis. So the PESTLE gives you defined factors to consider. So the P being political, the E being economic, S being social, T being technological, L being legal, and E environmental. So once you put in a grid these different factors, you can then work through methodically in that systematic way. What are those factors that are in the context of the environment that you're working within? Look at those external and those internal factors. You could also, as 45,002 mentions, do a brainstorm. So whatever exercise works to help capture those factors. But the key thing here is participation. So 45,002 does mention this. But again, coming from someone who started this journey, when I first did this, I did the PESTLE, but then I needed to assure myself that I'd covered everything. So I've got, in that my health and safety capacity, have knowledge of that organisation, but I'm not actively involved in all the different workings and the teams. So once I'd completed that, I did circulate it with colleagues, and but the information became a lot more richer for doing that. So again, another tip is participation, use brainstorming, use a PESTLE, a PEST, any other types of analysis tool. It will support with going through this process. Next slide, please. And so yeah, as I say, there's a wealth of information in 45,002, and I will paraphrase some of it just to give you a flavour of the content that's in there and how it can support those who are already going through the standard or will be interested in going through the standard. So again, I mentioned my commitment to cover the Plan, Do, Check, Act, but actually at the hub of that management system for me is that leadership and that worker participation, so that they're key. And I wanted to start here as well before getting into that detail. So leadership and commitment talks about top management engaging in, promoting, communicating and monitoring performance and effectiveness of the management system. So how do we do this? And I suppose it's how do you get assurance in the approach you're taking is sufficient, suitable? Are there other ideas of how can we do it? So I've extracted and condensed a little bit some examples taken from 45,002, because it gives case examples of small organisations, large organisations, because going back to what Jeremy's mentioned, the way, to be proportionate, the way in which you will apply and undertake this will be different from those micro businesses, SMEs, larger organisations as well, how we do achieve it. So leadership on this one relates to owner of a small organisation demonstrated commitment to providing a healthy and safe workplace by including examples of what had been done recently to improve OSH performance during the monthly organisation-wide meeting held with employees. But at these meetings, employees were also actively encouraged to provide feedback on both positive and negative experiences in that workplace. So again, this is that small organisation, they've got regular meetings, active encouragement, positive and negative from workers. And this was done consistently, and it demonstrated the commitment of that leadership in engaging employees in conversations at those meetings, and it started to develop the culture, which then linked back to supporting the intended outcomes of the management system. So those intended outcomes can relate to preventing injury and ill health, creating safe working environments, improving occupational health and safety performance, ensuring legal compliance, and obviously looking at the objectives that you've set within the policy, your intentions for health and safety. So that was in a small organisation. In larger organisations, there's a wealth of information. I've just picked out an example where it was embedded through performance objectives for managers and supervisors. So to ensure that from the top, it was cascaded down, it's in the values, it's in the vision, and it also follows through the whole business planning, strategic plans into individual manager and supervisor performance objectives. So they relate specifically to health and safety, whether it be performance and the management system. So there are a couple of examples on leadership. Regarding consultation and participation of workers, I've very much been used to formal structures of doing this through health and safety committees. In previous workplaces that have been represented, trade union approved representatives, also having staff employee forums. So it's a very formal settings, but again, appreciating that different businesses will be structured very differently, but it's important that you do get that opportunity for two-way feedback and engagement using different levels of staff across the business. So workers, managers, how do you get that involvement? So an example in 45,002 is around involving all workers at all levels of the organisation. And in this example, which was a medium-sized logistics company, they did it using a matrix of all the processes within the management system where workers or worker representatives consulted or participated. So they found that this matrix looked at the touch points down the left-hand column and the different roles of who was consulted and participated. So again, they added a little bit more structure to that to make sure that they did have those touch points, and where could they ensure that they did have participation across all workers. So again, some ideas on how you can do that within your organisation. Next slide, please. Oh, fantastic, thank you. So I'm now at the planning. I've got a slide on Plan, Do, Check, Act. Starting with planning, this is a really big section, and I'm not sure I'll be able to cover it in full, but hopefully I can give you a flavour of the information that's in there. And it's really important for me to touch upon the hazards and the assessments and what to do within this remit, because as Jerry mentioned, this is a key part of those suitable, sufficient assessments that we need to go through anyway. So in order to get to that assessment, we need to identify the hazards. And I thought this would just be a useful table just to put on the slide there for you. So starting with hazard identification, you should proactively determine sources, situations or tasks arising from an organisation's activities that have the potential to cause physical or psychological injury or ill health. So here's an example that's taken from 45,002, whereby that process has gone through. There's a column looking at the task, the activity and the process, and then the hazards. So the first one, food preparation for own staff and hospital staff, and then it talks through the different hazards that are associated. So that's one option that might be suitable to you. I've seen it also done through inventory lists, or just through that risk assessment process within different teams and activities as well. So it will be whatever fits your organisation. And to be honest, I've also gone into workplaces where they've had folders and folders of these, but they're not shared with the people who need them. So there is a process around all of this, and they need to be communicated and shared and understood, and involved as well, employees involved in this process. Again, in workplaces where I've been previously, you almost get looked at as the health and safety professional to go, you do our risk assessment, but I'd always say, well, I've never been a social worker. I've never worked in a school myself. So the knowledge needs to come from those on the ground doing the activities to input into this exercise as well. So some good information in 45,002 about how to do that hazard identification. And there's also a wealth of information on the other clause, which is around the assessment of OHS risks and other risks to the management system itself. Too many, in fact, to go through in my 10 or 15 minutes that Lockie's given me, but I'll give an overview to say that 45,002 does provide detail on risk assessments and different methodologies that are available. So it covers simple methodologies, you know, sort of those low risk being proportionate environments, and it'll also go into assessments that can be undertaken for complex situations. So more chemical situations, as an example, where they might be using HAZOP, so hazards and operability analysis, or failure mode effective analysis, and even bow tie examples. So you might have heard these terms before, you might even be using them. Well, information, there's information on these in 45,002, but the key is using the one that is proportionate and relevant to your risk profile and your activities. And also to be aware that in many countries, there is also sector-specific legislation, which will help to identify where that degree of flexibility would be required for you. So again, useful source of guidance on this, but there'll be other sources that you should also use in relation to your sector-specific activities, or even based on the legal requirements of the country that you operate within. Next slide, please. And Lockie, do give me a nod if I overrun your timings, please. Doing competence. So competence obviously enables a person or an organisation to act effectively in a job or situation, and it can be acquired through training, education, experience, or a combination of these. So it's not always formal training. And I suppose, given an example, for me, again, I've used a good old-fashioned matrix on this, where we've looked at all the different job roles and profiles down the left-hand side, looked at what they needed to do that job, and then we've mapped across to make sure that we can provide. And you know, I've done this at an organisational level to do that training needs analysis. Then obviously it can be distilled down further into different directorates or teams, functions, depending on how your structure is organised. But it's important that you use that to look at what those different roles are, what do they need, and how can you fulfil that requirement. The other one, again, another really big section, communication. And this is another area that's particularly important, and I do see where there is failings in communication that you can get the impact through the organisation, either through not ensuring people are briefed and informed, through understanding, awareness. I mean, Jeremy mentioned these large policy documents. You can have fantastic written management systems, but if they actually aren't communicated or understood, you are losing the true value and the meaning of why they're there. So communication is really important, and I did like the example of the video, Jeremy, and just to be that it can be done in different ways now. We've got more technology available. How do you communicate this so it is understood? And obviously people like communication in different ways. I've realised delivering training recently that short, bite-sized information's obviously of value to more long, formal sessions. Different generations capture information and learn differently and want it in different formats. So your communication, it's key. And for me, I've done this by using a communication plan, looking at the different target audiences and how I needed to communicate what I needed to from the objectives that I'd set in my occupational health, safety and wellbeing policy. So that's what I've done. In 45001, it gives lots of other examples of how larger organisations have done this, examples being they've displayed the policy, they've displayed the objectives in the workplace, and they've also translated it for all workers to make sure it's understood. They've presented it at meetings. They've also done sessions to explain to workers their contribution to the management system. They've explained processes for reporting incidents, making sure that hazards, they're aware of hazards, the risk assessments and controls that have been put in place. So again, there can be lots of different ways to communicate, and it's making sure that you come through and do that in that proportionate way for your organisation. Next slide, please. So we get into checking now, and again, there's a few clauses on how you do this about that performance evaluation. I thought I would just pinpoint the indicators that you can use, which are either sort of titled proactive or reactive, leading or lagging performance indicators, because whenever I've done sessions before, they do generate some good conversation. So when we talk about leading indicators, it could be evaluating the effectiveness of occupational health and safety training, looking at behaviour-based observations as a result of that, perception surveys, and your reactive data could look at monitoring ill health, occurrences and rates of incidents and ill health, and receipts of any comments or complaints that you get in as well. So I've given you 3 of each, but there's a longer list in 45002, and we use those indicators as a good measure of that performance. And the table here is taken from 45002 about how to track that performance and achieve objectives. So what are you looking at? How are you measuring or monitoring that? How often are you doing it? Who's responsible? What's your criteria? So what's your measure? What's the result you're getting? And what's that evaluation? So this can be as simple or as detailed as you need it. So 45002 will give you those examples and guidance on how do we do some of this. Next and last slide for me is the next one, please, which is ACT. And again, I thought we use the term continual improvement, and I do hear some challenges to this sometimes around, is it about that gold plating and striving, and actually it's quite simple for me. It's not about doing improvements each and every day, but just to make sure that you are demonstrating that over time the management system and the performance is proactively getting better. So in order to get that improvement, it's about, good old-fashioned promotion, ensuring top management are involved, all the things that we've been saying that we continually improve once you're doing your check-in. Where are those areas you can improve upon? Having health and safety on meeting agendas, linking health and safety to strategic plans, celebrating different workers' contribution to health and safety performance. So there's not just one thing that applies here, but it links back to the entire management system and the approaches that you take, with the principle behind it around incrementally over that time making improvements. So I hope it's been useful, and I will stop there, Lockie, because I'm conscious we've got other questions to answer. So thank you all for listening.
Thank you very much, Ruth. That was great, really, really practical, which is obviously what we hope for and we're trying to do with this webinar. I can see some questions coming in from the audience as well, which is great. Please do keep posting those. Before we get into a couple of audience questions, we've got a few of our own discussion questions, just to pull out a bit more of the points that Ruth and Jeremy were talking about. So if we could have the next slide. And then we'll just go to the next slide as well, in the interest of time. Actually, we might go to the next one as well, which I think is a really key one, because it builds quite a bit on what Ruth was talking about. And I think having a really interesting perspective from a user point of view, Ruth, was great to see in your presentation. And you touched on small businesses as well as larger organisations, And obviously, Jeremy, as well, you have quite a lot of experience in seeing ISO 45001 implemented. So I wanted to get into this question on barriers. And what do you think are some of the common barriers to implementing ISO 45001 for businesses of any size, or you might want to answer from a particular point? And then as a follow-up question, are there examples in 45002 that particularly address those barriers or those pain points? So I might start with you, Jeremy.
Yeah, thank you, Lockie. I think probably one of the commonest barriers for small organisations seeking to implement the standard is time. I said right at the start of my presentation that a manager or director in a very small organisation will wear several hats, and I think faced with the standard, they will think, I can't do this, I simply can't fit it into my day, so I will call in a consultant to do it for me. And I think there's value in that, obviously, but I go back to what I said about selecting a consultant, a health and safety consultant who has awareness and knowledge and experience of your sector. But I think there's also a potential danger there as well, particularly if you go into it with the mindset that reflects the words I used. I'll get a consultant to do it for me, because if they're doing it for you, to what extent is this something that you then own? And the work that we've done in HSE over a number of years suggests that it's all too common, unfortunately, when small businesses employ a health and safety consultant, for them not to ask enough questions at the start, and then simply to take the documentation that the consultant has produced and put it on a shelf as though it was some kind of bulletproof vest or magic charm that prevents anything dangerous or unsafe happening. And it won't do that unless the organisation has understood what the consultant has written and is at least beginning to implement any changes that the consultant has identified as necessary. We are, and I'm not talking here specifically about implementing 45001, but more generally with health and safety consultancy. We're all too familiar in HSE with one or two of the large health and safety consultancy organisations that produce vast amounts of paperwork that don't seem to translate into active, working, living documents for the business that's paid in some cases a lot of money for them. And you know, I wouldn't quite say that we use those documents as a kind of a warning bell to say, right, we need to look more closely at what this organisation is doing, but it's disappointing, I think, because it shows that you know, potentially businesses are not getting value for money from the way they use consultants.
Thanks very much, Jeremy. And Ruth, what do you think on this question?
Yeah, I mean, again, I've jotted down the time, the resource, not necessarily understanding the benefits of management system or 45001, and possibly not having top management commitment as well. So it's, again, working in health and safety, there is, and we talk about, I suppose, that business case of health and safety, those wider benefits, you know, not just looking at the compliance which it brings, but also those wider benefits that it can bring. And through OHS, we've been looking at the links to social sustainability for that reason. You know, if you've got safe, healthy workers, actually they'll be more productive and engaged and motivated at work. So I think some of those barriers are just not understanding those full benefits of the management system, doing it in that structured way. And I suppose I was reflecting, Lockie, when I've done this previously in large organisations, you know, the scope of that management system, it can seem daunting if you think we've got hundreds of sites across the UK or internationally. How do you do that? But again, there are ways you can, through your scope, look at those management systems. And And I suppose what 45,002 does help with, it gives you some of that narrative and context on what you can do in those different types of situations. So there are many barriers, but it's sort of working through those for your organisation. But as Jerry mentioned at the start, you know, the systematic approach, the organising, the arranging, the monitoring, the measuring, we need those fundamental aspects, but it's how you go about doing that. And I say 45,002 gives you some guidance on supporting 45,001 if that's your direction of travel.
Brilliant, thank you, Ruth. If we could go forward 2 slides, please. Yep, and just 1 more slide. So practical tips. So just to build on those answers, because I think that was a really kind of interesting discussion question to look at after the presentations. If we think about leaving everyone with kind of 1 actionable tip, so maybe you know, a 1-sentence action to go away with after listening to this webinar. And Jeremy, for you, it might be from the small business perspective, Ruth, perhaps from the large organisation, or potentially for someone that's already implementing ISO 45001. But what is one thing that they, our listeners can go away and do tomorrow? So what's one thing to either do or get underway? Jeremy, if we could start with you.
Okay, thank you, Lockie. So I think looking at either 45,001 or 45,002, I think there are parts of Clause 8 on the operation of your health and safety management system that are incredibly valuable and we pay close attention. And I suppose given all that's happened over the 3 years now that we've lived with COVID, I want to focus very specifically on either management of change or emergency preparedness and response, and just look at if you're already using the standards, look at what you say you do to manage emergency situations or situations where sudden rapid change is required, and ask yourself, in respect of COVID or in respect of maybe some other crisis that you are actually currently facing, how are we doing? Are we well enough set up to manage this, or is there anything further? Do we need to go around the plan, do, check, act cycle again? I think we all too frequently fall into the habit of thinking about what we do day to day, and we don't think about these non-normative situations where something's gone wrong, or you know, there's a national crisis of some sort where we need to maybe do things differently. And the best organisations will survive those crises better because they've identified what they need to do to manage in those excursion or unusual situations. And the same applies to the very smallest organisations that may be using more simple systems to gauge how they're currently managing health and safety, whether that's the little book of health and safety I mentioned or health and safety made simple. Don't just think about the day-to-day, think about the extreme, the extreme but possible, you know, given what we've all been through over the past 3 years.
Thank you, Jeremy. And Ruth, what about you?
Yeah, I'd probably say go back and take a look at the objectives, so what the commitments are and the intentions through your occupational health and safety management system. And interestingly, Jeremy, when I did last review the policy position statement for our organisation, we did pull out and strengthen the emergency situation aspects, so the preparedness and the response. So although it was in there in the management system, it had its own clause, it was something that was elevated and more explicitly mentioned at that top level. So they probably join quite nicely, Lockie. So have a look at the objectives and just everything we've mentioned, you know, through that leadership. Be clear on what you want to achieve, and then you can follow that through from the objectives of how you'll go to achieve that.
Thank you very much, Ruth. And I'm conscious of time. We've only got 1 minute left, and there is something on the final slide that I really want to make sure we get to and everybody sees. We did have a couple of really good audience questions that I think we will try and answer them offline and circulate them with the resources for this webinar. So if we could just go to the next slide, please. As I mentioned, I am the committee manager for the ISO committee as well as the UK National Committee. You can find out more about the whole family of standards at the web link there. If you have any questions or you're interested in getting involved with standards development, please do feel free to drop me an email. My contact details on the screen there. And the very last slide. So thank you for attending. This is the last thing I wanted to say today, but in particular to draw your attention to a discount code. So all attendees today, if you are interested in buying BS ISO 45002, you can use the 10% discount code there. The code's on the screen. It's available for 1 month from today, so that's till the 12th of May. And just one final quick reminder that the event survey will come around after the webinar closes, so please do fill that out and we will send you over the resources. A big thank you to both of our panelists, Jeremy and Ruth. It was absolutely wonderful, full of actionable tips and practical insights. So thank you very much, and thank you very much again, everyone, for attending.